Question 1. A pregnant patient is scheduled for an ultrasound at her 16th week of pregnancy and asks what information can be obtained from an ultrasound at 18 weeks. What can be determined from the ultrasound at 18 weeks? A. Eyebrows and eyelashes. B. Gestational age. C. Meconium stool in the intestinal tract. D. Tiny buds of the fingernails. Correct answer, B. Gestational age. At 18 weeks of pregnancy, an ultrasound can be used to assess gestational age by measuring the fetus's size, such as the crown to rump length or femur length. These measurements help estimate the age of the fetus and can also be used to confirm the due date. Question 2. Which infant reflex typically disappears between 1 month and 6 weeks of age? A. Moro reflex. B. Palmar grasp reflex. C. Rooting reflex. D. Stepping reflex. Correct answer, D. Stepping reflex. After 6 weeks, the stepping reflex fades as the ratio of weight to leg strength increases. The Moro reflex is present at birth, peaks during the first month, and begins to fade around 2 months. The rooting reflex is present at birth and typically disappears by 4 months. The palmar grasp reflex present at birth persists until 5 or 6 months of age. Question 3. You are evaluating the health screening of a 10-month-old infant. Which of the following should be a cause for concern? A. The baby can't understand one-step directions, such as sitting down. B. The baby can't walk. C. The baby cannot roll from tummy to side. D. The baby does not speak in simple sentences. Correct answer, C. The baby cannot roll from tummy to side. By 10 months, a baby should have basic gross motor skills, including rolling from tummy to side, which typically develops by 4 to 6 months. Failure to do so may signal motor delays or neurological concerns. Walking usually begins between 12 to 15 months, though some may start earlier. Speaking in phrases generally emerges around 2 years of age. Question 4. During a school scoliosis screening, which sign might suggest the presence of scoliosis? A. Severe pain when lifting one leg. B. Steady weight loss. C. Frequent scratching of the back and shoulders. D. A visible hump on one side when bending forward at the waist. Correct answer, D. A visible hump on one side when bending forward at the waist. Scoliosis causes a lateral curvature of the spine with vertebral rotation, leading to asymmetry. The Adams forward bend test helps identify this by revealing a rib hump or uneven back. Question 5. When is the best time for women to perform a breast self-exam? A. After ovulation occurs. B. Before the start of the menstrual period. C. Prior to ovulation. D. Between day 5 and 7 of their menstrual period every month. Correct answer, D. Between day 5 and 7 of their menstrual period every month. The best time to perform a breast self-exam is between days 5 and 7 of the menstrual cycle, when hormone levels are lower and the breasts are less swollen or tender. This allows for easier detection of any abnormalities. Conducting the exam before or after ovulation can lead to increased breast tenderness and lumpiness due to hormonal fluctuations, making it harder to identify unusual lumps. Question 6. When is the best time for men to check for testicular masses? A. After bathing. B. After intercourse. C. Before bathing. D. Early in the morning. Correct answer A. After bathing. Warm water relaxes the scrotum, making it easier to feel for any lumps, swelling, or abnormalities. Checking after bathing provides a more comfortable environment and enhances the ability to detect any changes in the testicles. Question 7. Which illnesses should vaccinations help prevent in people over 60 years of age? A. Pneumonia and hepatitis. B. Pneumonia and shingles. C. Shingles and chickenpox. D. Shingles and meningitis. Correct answer B. Pneumonia and shingles. Older adults, especially those over 60, are at higher risk for complications from both illnesses. The pneumococcal vaccine helps protect against pneumonia, which can be severe in older adults, and the shingles vaccine helps prevent shingles, a painful condition caused by the reactivation of the varicella zoster virus. Question 8. While working in a nursing home, you witness a nurse's aide forcefully grabbing a confused elderly resident by the arm because he refuses to follow instructions. What should you do? A. Pretend you didn't see it. B. Report the abuse immediately. C. Warn the aide privately that they will be reported if it happens again. D. Document the incident in the progress notes without taking further action. Correct answer B. Report the abuse immediately. Any form of abuse, including physical force against a vulnerable resident, must be reported immediately to protect the patient and ensure proper intervention. Delaying or ignoring the situation could lead to further harm and is a violation of ethical and legal responsibilities in patient care. Question 9. Your patient becomes more confused and combative as the sun begins to set each afternoon. What condition is the patient most likely experiencing? A. Moonlight madness. B. Seasonal affective disorder. C. Sundowner's syndrome. D. The effects of a full moon. Correct answer C. Sundowner's syndrome. Sundowner's syndrome, or sundowning, refers to increased confusion, agitation, and combativeness that some individuals, especially those with dementia or Alzheimer's disease, experience in the late afternoon or evening. The symptoms tend to worsen as daylight decreases. Question 10. During morning care for your alcoholic patient, he touches you inappropriately. How should you respond? A. Leave the room and avoid the patient for the rest of your shift. B. Ignore the behaviour, assuming he doesn't understand what he is doing. C. Make light of the situation and act as if it didn't occur. D. Inform the patient that his actions are inappropriate and will not be accepted. Correct answer D. Inform the patient that his actions are inappropriate and will not be accepted. Addressing inappropriate behaviour directly is critical in maintaining professional boundaries and ensuring a safe, respectful environment for both the healthcare provider and the patient. By informing the patient that their actions are unacceptable, you establish clear limits, help the patient understand the behavior is not tolerated, and prevent further inappropriate actions. This approach is necessary to maintain respect and safety in a healthcare setting. Question 11. Which medication is most suitable for managing alcohol withdrawal symptoms? A. ACE inhibitors. B. Benzodiazepines. C. Calcium channel blockers. D. Narcotics. Correct answer B. Benzodiazepines. Addressing inappropriate behavior directly is critical in maintaining professional boundaries and ensuring a safe, respectful environment for both the healthcare provider and the patient. By informing the patient that their actions are unacceptable, you establish clear limits, help the patient understand the behavior is not tolerated, and prevent further inappropriate actions. This approach is necessary to maintain respect and safety in a healthcare setting. Question 12. A patient prescribed carbamazepine asks the nurse about its use. The nurse explains that the medication may be used to treat which of the following conditions? A. Alzheimer's disease. B. Chronic pain. C. Epilepsy. D. Parkinson's disease. Correct answer C. Epilepsy. Carbamazepine is primarily used to treat epilepsy, also known as seizure disorders. It works by stabilizing the electrical activity in the brain and is particularly effective for certain types of seizures, including partial seizures and tonic-clonic seizures. Question 13. What is the most important assessment for the nurse to perform on a patient taking oral contraceptives during her annual pelvic exam and medication refill? A. BUN and creatinine. B. Blood pressure. C. Blood glucose. D. Oxygen saturation. Correct answer B. Blood pressure. Oral contraceptives, particularly those containing estrogen, can increase blood pressure due to fluid retention and vasoconstriction. Therefore, monitoring blood pressure is crucial during checkups and medication refills, as elevated blood pressure may necessitate adjusting or discontinuing the contraceptive to reduce cardiovascular risks. Question 14. You are taking care of a woman in labour who practices the Orthodox Jewish faith. Where is her husband most likely to be during labour? A. At home. B. At the bedside. And C. In a synagogue. D. In the waiting room. Correct answer A. At home. Orthodox Jewish women are regarded as ritually impure once their water breaks, similar to when they are menstruating. As a result, an Orthodox Jewish husband may not be allowed to be present in the delivery room. Question 15. How should you respond to a 52-year-old patient recently diagnosed with COPD who is still smoking? A. Ask the doctor to tell them they need to quit smoking. B. Offer smoking cessation information and discuss the benefits of quitting. C. Share that you have seen many patients die from lung disease and suggest they quit. D. Warn the patient that smoking will kill them slowly. Correct answer B. Offer smoking cessation information and discuss the benefits of quitting. Smoking cessation is the most effective way to slow COPD progression, and a patient-centered approach increases the likelihood of success. Question 16. Your patient is due to receive a nighttime medication but declines to take it. Which of the following is the most appropriate response? A. You'll still need to take it tomorrow night. B. Can you share why you don't want to take it? C. Are you aware of the consequences of not taking your medication? D. Your doctor won't be happy about this. Correct answer B. Can you share why you don't want to take it? Patients may refuse medication for various reasons, such as side effects, fear, misunderstanding, or personal preferences. By asking an open-ended question, the provider can address any misconceptions, offer reassurance, or explore alternative options if needed. Question 17. Which medication is most suitable for managing alcohol withdrawal symptoms? A. ACE inhibitors. B. Benzodiazepines. C. Calcium channel blockers. D. Narcotics. Correct answer B. Benzodiazepines. Benzodiazepines are the most commonly used medication for managing alcohol withdrawal symptoms. They help reduce the risk of seizures, alleviate anxiety, and provide sedation to ease the symptoms of withdrawal. Narcotics are not suitable as they are used to treat severe pain and can lead to dependence. Calcium channel blockers and ACE inhibitors are used to treat hypertension, not alcohol withdrawal. Question 18. The parents of your teenage patient are worried that the patient may be suicidal and ask what warning signs they should be aware of. Which of the following should you include in your guidance? A. Increased use of alcohol and drugs. B. Obsession with possessions. C. Decrease in risky behaviors. D. Sudden desire to be with others. Correct answer A. Increased use of alcohol and drugs. Increased use of alcohol and drugs is a known warning sign of suicidal risk in teenagers, as substance abuse can impair judgment and increase impulsivity, potentially leading to suicidal behavior. Question 19. Which culture views disease as an imbalance in the life forces? A. African American. B. Mexican American/Hispanic. C. Muslim. D. Vietnamese. Correct answer D. Vietnamese. In Vietnamese culture, health is viewed through the lens of Am and Duong, yin and yang, where disease is seen as an imbalance between these vital life forces. This perspective is deeply rooted in traditional Vietnamese medicine and cultural beliefs, which are heavily influenced by Chinese medicine and philosophy. Question 20. When do withdrawal symptoms typically peak after the last dose of methadone hydrochloride? A. 8 to 24 hours. B. 24 to 48 hours. C. 48 to 72 hours. D. 72 to 96 hours. Correct answer C. 48 to 72 hours. Methadone is a long-acting opioid used for opioid substitution therapy, and its withdrawal symptoms typically peak later compared to shorter-acting opioids. Withdrawal from methadone usually begins within 24 to 36 hours after the last dose, and symptoms typically peak between 48 to 72 hours, which is when they are most severe. After this peak, symptoms gradually subside, although some discomfort may persist for several weeks. Question 21. What should you do when the family and close friends gather in the waiting room after a patient has died? A. Require everyone to view the body to aid in closure. B. Only allow immediate family members to view the body. C. Offer the chance for those who wish to view the body to do so. D. Inform the family they can view the body at the funeral home. Correct answer C. Offer the chance for those who wish to view the body to do so. Offering the opportunity for family and close friends to view the body can help provide closure and allow them to say their final goodbyes. It respects individual needs and feelings, recognizing that some may find comfort in this act while others may not wish to participate. This approach is compassionate and sensitive to the grieving process. Question 22. As you explain a surgical procedure to a Chinese-American man, he smiles and nods his head repeatedly. What might this behavior indicate? A. The patient does not speak English and requires a translator. B. The patient is exhibiting culturally typical behavior. C. The patient agrees with your explanation. D. The patient fully understands what you have explained. Correct answer B. The patient is exhibiting culturally typical behavior. In many Asian cultures, including Chinese culture, smiling and nodding can indicate attentiveness and respect rather than explicit agreement or understanding. This behavior is often a cultural norm and does not necessarily mean that the patient comprehends the explanation given. Therefore, while the patient may be engaged, it is crucial to confirm understanding through additional questions or clarifications, rather than assuming that nodding equates to agreement or comprehension. Question 23. In a patient diagnosed with conversion disorder, how is anxiety experienced? A. Consciously felt by the client. B. Diffuse and free-floating. C. Localized and is relieved by the symptoms. D. Projected onto the environment. Correct answer C. Localized and is relieved by the symptoms. In conversion disorder, anxiety is often internalized and expressed through physical symptoms, which relieve the anxiety by eliminating the need for the patient to consciously confront conflicting behaviors. The anxiety is localized to the physical manifestation, not consciously felt. Question 24. Which of the following characteristics is commonly observed in patients who discontinue amphetamines? A. Apathy. B. Increased attention span. C. Increased psychomotor activity. D. Spontaneous speech. Correct answer A. Apathy. When patients discontinue amphetamines, they may experience withdrawal symptoms, which often include apathy or a lack of interest in activities. This is because amphetamines stimulate the central nervous system, increasing dopamine and norepinephrine levels, which enhance motivation and energy. When these drugs are no longer used, the sudden drop in these chemicals can lead to feelings of apathy, lethargy, and low energy. Question 25. Your patient has been diagnosed with mania. Which medication is commonly used to treat and/or prevent manic episodes? Olanzapine. B. Seroquel. C. Morphine. D. Lithium. Correct answer D. Lithium. Doctors often use lithium to treat manic episodes of bipolar disorder. Morphine is an anesthetic, while Seroquel and olanzapine are antipsychotics. Question 26. Why do individuals with mania often refuse to take their medication? A. They feel energetic and euphoric and enjoy these feelings. B. They easily forget to take their medication. C. Mania causes cognitive changes that impair their judgment. D. Medications for mania may cause vomiting and/or diarrhea. Correct answer A. They feel energetic and euphoric and enjoy these feelings. Individuals experiencing mania often feel highly energetic, euphoric, and invincible. These elevated feelings can cause them to underestimate the severity of their condition and reject treatment because they don't perceive the need for intervention. Question 27. Your patient presents with fever, abdominal pain, and difficulty urinating. Based on these symptoms, you suspect pyelonephritis. What is the most common microorganism responsible for causing pyelonephritis in community-acquired cases? Enterococcus faecalis. B. Escherichia coli. C. Klebsiella. D. Pseudomonas aeruginosa. Correct answer B. Escherichia coli. Pyelonephritis is a serious kidney infection that can spread to the bloodstream and lead to severe complications. However, it can usually be effectively treated with antibiotics. Around 70 to 80% of pyelonephritis cases are caused by Escherichia coli, E. coli, and to a lesser extent Enterococcus faecalis, both of which are commonly present in the intestinal tract. Question 28. When a client is in the side-lying position, which part of the body is most adversely impacted by pressure? A. The sacrum. B. The heels. C. The coccyx. D. The ears. Correct answer A. The sacrum. The sacrum, located at the base of the spine, does not have a thick layer of soft tissue to cushion it, making it highly susceptible to pressure injury in the side-lying position. The weight of the body can create significant pressure on this area, especially if the individual remains in that position for an extended period. Question 29. After a single leg amputation, which cane gait should the nurse demonstrate to the patient using a prosthesis? A. 4-point gait. B. Swing-through crutch gait. C. 3-point gait. D. Tripod crutch gait. Correct answer C. 3-point gait. After a single leg amputation, a patient with a prosthesis typically uses a 3-point gait. This gait involves moving the crutches and prosthetic leg forward together, followed by the non-amputated leg. It is designed for situations where one limb cannot bear weight and helps maintain stability, proper weight distribution, and balance while walking with the prosthesis. Question 30. Your patient has an infectious cause of diarrhea and has been prescribed antibiotics. He asks what he should eat until the diarrhea subsides. Which is the best response? A. Eating apples will reduce the incidence of diarrhea. B. Eating rice can help manage diarrhea. C. Eating a high-fiber diet will reduce diarrhea. D. Due to the dehydrating effect of caffeine, it should be avoided. Correct answer B. Eating rice can help manage diarrhea. Rice is part of the brat diet, bananas, rice, applesauce, toast, which is often recommended for managing diarrhea. It is bland, low in fibre, and helps to firm up stools, making it a suitable choice during episodes of diarrhea. Question 31. A patient has a long-legged cast. Which of the following is a sign of impaired circulation that the nurse should monitor for? A. Increased temperature. B. Drainage on the cast. C. Foul odour. D. Swelling of the toes. Correct answer D. Swelling of the toes. Swelling of the toes is a sign of impaired circulation, which can occur if the cast is too tight or if there is increased pressure within the limb, for example due to compartment syndrome. Poor circulation can lead to numbness, tingling, coldness or discoloration of the toes, requiring immediate intervention to prevent tissue damage. Question 32. Which of the following interventions would assist an older woman who has recently had hip replacement surgery in starting to regain her mobility? A. Helping the patient walk down the hallway. B. Assisting the patient to stand up from her chair. C. Encouraging daily visits from her family. D. Installing an overhead trapeze on the bed. Correct answer B. Assisting the patient to stand up from her chair. After hip replacement surgery, regaining mobility typically starts with activities that promote independence in basic movements, such as standing and sitting. Assisting the patient to stand up from her chair directly helps her develop the strength and coordination needed for walking and other movements. Question 33. Which of the following positions is most effective in relieving serious abdominal pain? A. Dorsal recumbent. B. High Fowlers. C. Prone. D. Supine. Correct answer A. Dorsal recumbent. The dorsal recumbent position, where the patient lies on their back with knees bent, can help relax the abdominal muscles and reduce tension in the abdomen. This position is typically more comfortable for individuals with abdominal pain, as it allows for better alignment of the body and may help alleviate pressure on the abdomen compared to the other positions listed. Other positions may add pressure to the abdominal cavity, which can increase pain. Question 34. A nurse is performing a dietary evaluation on a patient following a vegetarian diet. Which vitamin-rich foods might be deficient in the vegetarian's diet? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin E. Correct answer B. Vitamin B12. Vitamin B12 is primarily found in animal-based foods like meat, poultry, fish, dairy, and eggs. Since vegetarians exclude animal products from their diet, they may be at risk for a vitamin B12 deficiency. This vitamin is essential for the production of red blood cells and the proper functioning of the nervous system. deficiency in vitamin B12 can lead to anemia, neurological issues, and other health problems. Question 35. A nurse is caring for a patient one day after a total hip arthroplasty. What is the most appropriate position for the nurse to place the patient? A. Lying on the side with the affected leg turned outward. B. Lying on the side with the affected leg turned inward. C. Lying on the non-operative side with the legs apart. D. Lying on the surgical side. Correct answer C. Lying on the non-operative side with the legs apart. After a total hip arthroplasty, it is crucial to avoid positions that can lead to hip dislocation or complications. Lying on the non-operative side with the legs apart helps maintain proper hip alignment and prevents excessive internal rotation or adduction of the operative leg, which could result in dislocation. Question 36. The client is already receiving sodium bicarbonate. What should the nurse do before administering the calcium gluconate? A. Position the client's head of the bed at 90 degrees. B. Start a new intravenous line for the client. C. Administer calcium gluconate through the same line as sodium bicarbonate. D. Infuse the calcium gluconate quickly to avoid irritation. Correct answer B. Start a new intravenous line for the client. Sodium bicarbonate and calcium gluconate should never be administered through the same IV line. When these two medications are mixed together in the same line, they can react and form a precipitate, which can cause serious complications such as vascular irritation, clot formation, or damage to the blood vessels. Question 37. How should the nurse respond to a client taking methotrexate for rheumatoid arthritis who reports not feeling any relief after 2 weeks of treatment? A. Are you taking the medication exactly as prescribed? B. Do you exercise regularly to improve your mobility? C. I will inform the healthcare provider. D. The therapeutic effects will be delayed a few more weeks. Correct answer D. The therapeutic effects will be delayed a few more weeks. Methotrexate is a disease-modifying anti-rheumatic drug used to treat rheumatoid arthritis. However, it typically takes several weeks to months to experience its full therapeutic effects. For most patients, 2 weeks of treatment is not enough time to see significant symptom relief. Question 38. Which of the following is least important to assess when evaluating a client's motor skills? A. Knowledge of ergonomics. B. Coordination. C. Balance. D. Strength. Correct answer A. Knowledge of ergonomics. Motor skills assessments typically focus on the client's strength, coordination, balance, range of motion, and ability to perform specific movements or tasks. Knowledge of ergonomics is more related to understanding body mechanics and how to perform tasks in a way that minimizes strain or injury. While important for preventing injury, it is not a direct measure of the client's physical motor abilities. Question 39. Which of the following is least important when assessing a client's risk for elimination impairment? A. Ambulation abilities. B. Current medications. C. Family history. D. Hydration status. Correct answer C. Family history. Elimination issues are typically influenced by factors such as the client's current medications, hydration status, and ambulation abilities, which directly impact bowel and bladder function. Family history may have some relevance in certain conditions, but does not have as direct an effect on immediate elimination impairment compared to the other options. Question 40. A 36-year-old female client is scheduled for a mastectomy in the morning. What is the primary responsibility of the nurse? A. Checking for any missing lab works. B. Explaining the procedure and outcomes. C. Taking the vital signs. D. Obtaining the consent for surgery. Correct answer D. Obtaining the consent for surgery. The nurse's primary responsibility is to ensure that informed consent is obtained from the patient. This includes confirming that the patient understands the procedure, risks and benefits, and that they have had the opportunity to ask questions. Question 41. A diabetic patient suddenly exhibits confusion and diaphoresis. Which action should the nurse prioritize first? A. Offer the patient a small apple juice. B. Check the patient's blood sugar. C. Administer insulin as ordered. D. Administer glucagon 4 as ordered. Correct answer B. Check the patient's blood sugar. Confusion and diaphoresis, sweating in a diabetic patient, can be signs of hypoglycemia, low blood sugar. The first priority is to check the patient's blood sugar level to determine if it is low. If the blood sugar is low, then the nurse can proceed with the appropriate action, such as offering juice or administering glucagon. Checking the blood sugar is essential before administering treatment to avoid causing harm by giving insulin if the patient's blood sugar is already low. Question 42. A patient recently prescribed ezetimibe asks the nurse about the purpose of this medication. Based on its mechanism of action, the nurse knows ezetimibe is used to treat which condition? A. Congestive heart failure. B. Hypertension. C. Hyperlipidemia. D. Osteoporosis. Correct answer C. Hyperlipidemia. Ezetimibe is a medication used to lower cholesterol levels, particularly low-density lipoprotein cholesterol. It works by inhibiting the absorption of cholesterol in the small intestine, which reduces the amount of cholesterol that enters the bloodstream. This helps in the treatment of hyperlipidemia, high cholesterol, particularly when used in combination with other lipid-lowering drugs like statins. Question 43. A patient is admitted with an acute myocardial infarction and the physician orders aspirin 325 mg orally. What is the primary action of aspirin in this context? A. Blocks vitamin K synthesis. B. Decreases platelet aggregation. C. Inactivates clotting factors. D. Promotes coronary vasodilation. Correct answer B. Decreases platelet aggregation. Aspirin works by irreversibly inhibiting cyclooxygenase 1, an enzyme necessary for the synthesis of thromboxane A2, a chemical that promotes platelet aggregation and vasoconstriction. By reducing thromboxane A2 production, aspirin decreases platelet aggregation, which is crucial in preventing further clot formation in patients with an acute myocardial infarction, heart attack. Question 44. A patient is admitted to the hospital for chest pain and the nurse administers a nitroglycerin tablet. What change in vital signs can the nurse expect? A. Decreased blood pressure. B. Increased blood pressure. C. Increased heart rate. D. Palpitations. Correct answer A. Decreased blood pressure. Nitroglycerin is a nitrate that works by relaxing the smooth muscles in the blood vessel walls, leading to vasodilation. This vasodilation reduces systemic vascular resistance, decreases preload, and lowers blood pressure. These effects improve oxygen supply to the heart while reducing the heart's workload, which is critical in relieving chest pain caused by ischemia. Question 45. Which statement made by a patient recovering from cataract surgery requires clarification from the nurse? E. My eye should be completely healed after about 8 weeks. B. I know it's normal for my eyes to feel irritated or itchy after surgery. C. I know I may need glasses for a while after this surgery. D. I will use my Visine eye drops as needed. Correct answer D. I will use my Visine eye drops as needed. After cataract surgery, patients are usually prescribed specific prescription eye drops, such as antibiotic and anti-inflammatory drops, to help prevent infection and reduce inflammation. Visine is an over-the-counter eye drop often used to relieve redness or irritation, but it is not recommended after cataract surgery because it could cause dryness or irritation, or even interfere with the healing process. Patients should avoid using non-prescription drops like Visine unless instructed by their healthcare provider. Question 46. Which patient is most likely to exhibit a green stick fracture? An 8-year-old male who fell off a trampoline. B. A 28-year-old male who fell off his bike while in a triathlon. C. A 50-year-old male who fell off a ladder while fixing his roof. D. A 72-year-old female who fell while in the shower. Correct answer A. An 8-year-old male who fell off a trampoline. A green stick fracture occurs when a bone bends and cracks on one side but doesn't break all the way through, similar to bending a green twig. This type of fracture is more common in children because their bones are softer and more flexible. Question 47. During an abdominal examination of a 75-year-old male patient, you notice a pulsating mass below the umbilicus. What should be your next step? A. Auscultate the mass. B. Call the doctor. C. Palpate the mass. D. Do nothing. It is normal. Correct answer A. Auscultate the mass. A pulsating mass in the abdomen, especially in an older male patient, raises suspicion of an abdominal aortic aneurysm. If an aneurysm is present, palpating the mass could increase the risk of rupture, which can be life-threatening. The appropriate next step is to auscultate the mass using a stethoscope to listen for a bruit, a whooshing sound caused by turbulent blood flow, which may indicate an aneurysm. After auscultation, the findings should be reported to the physician for further evaluation and imaging, for example, ultrasound or CT scan. Question 48. What is the most effective way to prevent malaria while travelling to Southeast Asia? A. Avoiding untreated water. B. Avoiding undercooked food. C. Avoiding mosquito bites. D. Avoiding overpopulated areas. Correct answer C. Avoiding mosquito bites. Malaria is transmitted through the bites of infected Anopheles mosquitoes, so minimizing exposure to mosquito bites is the primary method of prevention. This can be achieved through various strategies, such as using insect repellent, wearing long sleeves and pants, and sleeping under mosquito nets. Question 49. Which of the following statements is true regarding contraception use? A. With practice, you can insert an IUD on your own. B. Birth control patches should be changed every 3 days. C. The primary ingredient in Depo-Provera is estrogen. D. Latex condoms should not be used with oil-based lubricants. Correct answer D. Latex condoms should not be used with oil-based lubricants. Latex condoms are effective in preventing pregnancy and sexually transmitted infections. However, oil-based lubricants, such as petroleum jelly, baby oil, or lotions, can weaken latex, making the condom more likely to break or tear. Water-based or silicone-based lubricants are safer alternatives. Question 50. Which age group should be examined last during an EENT, ear, eye, nose, throat, surgery? A. Toddlers and preschoolers. B. Infants. C. Pre-teenagers. D. Middle-aged adults. Correct answer A. Toddlers and preschoolers. Toddlers and preschoolers are typically more active and may be less cooperative during examinations. By examining them last, healthcare providers can minimize the risk of distress and ensure that the examination is conducted in a calmer environment after other, often more cooperative age groups have been seen.